Some will quietly protect your heart for years. The science is clearer than ever, with the lowest side effects profile. Your doctor has several classes of medications to choose from. The central agonist, talk to your healthcare provider. Loop diuretics, here is a truth your doctor probably never had time to explain. Not all blood pressure medications are created equal. Some will quietly protect your heart for years, while others could leave you drained, dizzy, and frustrated, wondering what's wrong with your body. In 2025, the science is clearer than ever. A few specific drug classes stand out as the safest, with far fewer side effects than the rest. So, if you were recently told you have high blood pressure and your doctor handed you that first prescription, pause for a second. Will you know if it is one of the safest options or one of the ones doctors now try to avoid unless they have no choice? In the next few minutes, I will walk you through the blood pressure medication classes that modern research call high risk and the ones that consistently protect patients with the lowest side effects profile. By the end of this video, you'll know exactly which medications to ask your doctor about and which ones to question so you can control your blood pressure without sacrificing your quality of life. Hi, my name is Nicholas, a pharmacy practitioner interested in hypertension management. Well, let us start with the one you should never take as your first option. When you are newly diagnosed with high blood pressure, your doctor has several classes of medications to choose from. But here's the thing, some of these drugs were developed decades ago and are still prescribed today, even though we now know they can cause more harm than good for most people starting treatment. Let us start with the central agonist. The most well-known in this class is clonidine. It works in your brain to lower blood pressure, but it is unpredictable and comes with a laundry list of side effects, dizziness, fatigue, and even dangerous rebounds hypertension if you stop it suddenly. So, if you are taking clonidine just for blood pressure and not for another medical reason, talk to your healthcare provider. It should never be the first drug you are prescribed for hypertension. Next up, alpha blockers like digoxin and prazosin. These medications relax your blood vessels, but studies show they can cause sudden drops in blood pressure when you stand up. They can also cause headaches and swelling. They are rarely used as first-line treatment today because the risks outweigh the benefits for most people. Then, we have the loop diuretics, that is furosemide and bumetanide. These are powerful water pills that make you urinate more. And while they can lower blood pressure, they also flush out important electrolytes like potassium and sodium. They are great for heart failure, but for someone with a simple high blood pressure, they are too harsh to start with. Finally, in this section, beta blockers such as metoprolol and atenolol. Now, these can be lifesavers for certain patients, especially those with heart disease or arrhythmias, but for someone with uncomplicated hypertension, they can lower your testosterone, increase blood sugar, and leave you feeling chronically tired. Unless your specialist specifically prescribed them for a reason beyond blood pressure, they are not your safest first option. The next group includes medications that can work well, but they come with few precautionary measures. First up, calcium channel blockers. Names you might recognize like amlodipine, verapamil, and deltesium. These are very popular and effective at lowering blood pressure by relaxing the muscles in your blood vessels. But they can also cause swelling in your ankles, flushing, and sometimes headaches. For some people, that swelling never goes away and it can really be frustrating. So, while calcium channel blockers are effective, they are not always the gentlest first option for everyone. Next, we have thiazide diuretics like hydrochlorothiazides, clothalidone, or chlorothiazides. These are often considered the old reliable of blood pressure drugs. They are inexpensive and they work, but they also tend to deplete your electrolytes, raise your blood sugar, and in some cases, even increase uric acid levels, which can trigger gout. So if you are taking thiazide and you are feeling muscle cramps, fatigue, or your blood sugar numbers are creeping up, it's worth discussing with your doctor whether there is a gentler option available. Now, let us talk about the classes that have consistently earned their places as safest and most effective for new patients with hypertension in 2025 going to 2026. First, the angiotensin converting enzyme inhibitors, abbreviated as the ACE. These end in pril like lisinopril, benazepril, or quinapril. They work by relaxing your blood vessels and helping your heart pump more efficiently. They have been around for decades and are well studied, and for most people are safe and affordable. The main side effect, a dry cough in a small percentage of people, and if you experience that, your doctor can easily switch you to the next class, the ARBs. ARBs, or angiotensin receptor blockers, are the real winners here. They include losartan, valsartan, and candesartan. They work similarly to ACE inhibitors but tend to cause fewer side effects. They don't cause the cough, they don't affect your blood sugar or hormone levels, and they are now widely available as generics, meaning they are affordable too, okay? Recent studies continue to confirm what pharmacists and physicians have observed for years. Angiotensin receptor blockers consistently offer the best balance between blood pressure control and side effect profile. So, if you are on ARBs, that's a strong sign your doctor made a solid evidence-based choice, okay? Now, here is where many people miss the bigger picture. Medication is important, but it's only part of the equation. Thousands of patients have successfully lowered and even reversed their high blood pressure by focusing on nutrition and lifestyle changes. A diet low in refined carbohydrates and vegetable seed oils, rich in real foods, lean proteins, fresh vegetables, and healthy fats can dramatically improve your blood pressure. Add in regular movement, quality sleep, and stress management, and many people find they can reduce their medication needs over time. But, and this is very crucial, never stop or change medication on your own. Always work with your healthcare provider. Use this information as a foundation for a conversation, not a replacement for medical advice, okay? So, here is your quick summary. Avoid starting with clonidine, alpha blockers, loop diuretics, or beta blockers unless there is a special reason. Thiazides and calcium channel blockers can work but may bring annoying side effects. ACE inhibitors are safe and effective for most people, and ARBs like losartan and valsartan remain the safest, best tolerated first-line medications for high blood pressure in 2025 going to 2026. The right medication should lower your blood pressure without making you feel worse, and when paired with smart lifestyle choices, it can completely change how you feel every day. So take this knowledge, talk to your provider, and make sure you are on a plan that truly supports your long-term health, not just your numbers on a blood pressure monitor. If this video helped you understand your medication better, please hit like and subscribe. It helps more people find trusted information about blood pressure and heart health, okay? Stay well, stay informed, and I'll see you in the next video. Bye.